Hi everyone, my name is Mia Cornejo and today I will be speaking to you on behalf of the American Lung Association to help educate our community about childhood asthma, as well as offer some helpful tips and advice and some adaptive recreation options suited for your loved one. So to begin, what is childhood asthma? Well, childhood asthma is also referred to as pediatric asthma, and it is a chronic lung disease that results in limitation and swelling of the airways, making it more difficult to breathe. So in children, this can bring serious complications because developing children do tend to have more narrow airways. So let's get to the demographics. As of 2022, over 44 million Americans, this is 13.5% of the population, was diagnosed with asthma by a medical professional. And of those 44 million, 6 million of those Americans were children. So the age range that is at highest risk for asthma is ages 1 through 11, and it is more commonly observed in boys than it is in girls under age 18. After age 18, the demographics do change a little. Black and Indigenous individuals also do hold the highest current asthma rates and are more likely than other races in their lifetime to be diagnosed with asthma. So you may be wondering, how do I know if my child has asthma? Well, there are common signs and symptoms to look out for, such as a frequent cough, especially at night, shortness of breath, chest tightness, or wheezing sounds. And if you are observing these in your child, please contact your physician or caregiver or seek medical attention. So with asthma, these symptoms can be triggered by a variety of things. And some common things that could potentially cause an asthma flare-up are smoking, exercise, allergies, weather, air pollution, animals, strong or overwhelming emotions, strong smells, certain medications, or infections that provoke your respiratory system can also be cause for an asthma flare-up. So there are two types of asthma, and depending on which an individual has, their prognosis will look a little different as they enter adulthood. The first kind is episodic asthma, and with this type of asthma, symptoms may appear and resolve themselves within a few days or following treatment. However, other viral or respiratory infections can still provoke these symptoms to reappear episodically, hence the name. The prognosis for this condition is that symptoms can have better resolution or appear more mildly into adulthood with more minimal lung impairment. The second kind is persistent asthma, and with this kind of asthma, symptoms may appear more regularly and are likely to be ongoing. Into adulthood, individuals may experience moderate lung function impairment and need to be a little bit more proactive about managing it. So how do we manage this? Well, there are lots of different ways to manage asthma, and some common asthma medications that are helpful to do this are bronchodilators, such as inhalers, anti-inflammatories, or antibiotics. But asthma can also be managed through other ways, such as exercise and recreation. And there are lots of great recreation options for individuals with asthma. Swimming is a great option for individuals with asthma because it is an aerobic exercise. This means that this exercise is going to be low impact, but it's still going to get your heart rate and breathing going. So swimming is great for this. It's great for strengthening lung capacity, and also research has found that the cool air from pool water can be anti-inflammatory for lungs. Yoga is another great recreation activity that promotes different breathing exercises while also improving balance, strength, and coordination. Other examples of recreation that are beneficial to those with asthma can be biking and jogging, but individuals with asthma need to exercise responsibly and ideally have some sort of asthma management plan. So some tips for exercising responsibly are: remember to have your inhaler, always. Practice different breathing exercises to work on improving lung capacity. Be aware of your asthma triggers and do your best to avoid them. And also warm up before exercising and cool down after to help acclimate your lungs. So to bring our conversation to a close, I know, so sad, but to bring our conversation to a close, I want to expose you to and offer a couple of different resources that our organization works closely with and supports. So we have some recommended podcasts regarding asthma and education and management, such as the Allergy Network and Asthma, or the Allergy and Asthma Network, sorry. But they have a lot of educational podcasts where you can find experts discussing the practical tips and strategies to know when managing pediatric asthma, and this is made with parents and caregivers in mind. The Mayo Clinic Radio also offers a lot of education podcasts regarding pediatric allergies and asthma, and that's another great resource to check out. For any further questions, please message us on our American Lung Association online message board, or email us at info@lung.org. But for any other urgent questions or immediate care, please give us a call. Our phone